Hi, I'm Dr. Tom Dawson. Congratulations, you just brought a new life into the world. Today is a big day. And from here on, everybody's going to have a ton of advice for you. But before we get to that, just remember, back in the old days before the internet, we used to just let mom and baby both just sleep all day the first day. To be honest, you've both been through a train wreck. I've been to thousands of deliveries, and for the mom, it's a train wreck. And so you deserve a day to get to sleep. And for your baby, anything that moves the bones in your skull around to kind of make it easier for the baby to come out, anything that moves the bones in my skull around kind of gives me a headache. And the babies that I've talked to that could talk on the first day of life said that they have a headache too, and they just kind of like to sleep. So they may not be the best speeders, and you may not be the best mom on the first day. Both of y'all can just sleep. Now, for a lot of moms, it's a pretty big adrenaline rush to bring a new life into the world. And so you may be full of adrenaline and wanting to call everybody and tell everybody the good news. And that's fine too. But just remember, this is a marathon, not a sprint. So after a while, let's turn your phone off and let's see if we can't get some sleep. So the main thing to keep in mind at first is there's a ton of things that seem like they're a big deal for the first few days. And they're really not that big deal. So let's talk about each one. First of all, your child is going to lose weight every day for the first 5 days. That's what they're supposed to do. Whoever was in charge of design realized that babies aren't very good drinkers for the first 5 days, and so they prepackaged them with a bunch of extra water. What they did is they packaged them underwater for the first 9 months while they were inside you. It'd be like if you and dad spend 9 months in the bathtub, you would come out super pruny, and your baby comes out super pruny. And they tend to absorb and use some of that water and pee off a lot of it each day so that they lose 2 to 3 ounces of fluid weight every day for the first 5 days. Then things kind of bottom out, and we expect them to get back to their birth weight by the time they're about 2 weeks old. Now, the benefit of peeing off this extra fluid is you get where you can see their facial features a little bit better and even their eyes by the time they're 2 or 3 days old. So you get to see that your baby looks a little bit more like you. So let's not worry about the weight loss at first. It's perfectly normal. The next thing that comes to mind is that the shape of their head, we just talked about how the bones in your skull move around a little bit to shape their head more like a basketball so it can get, not a basketball, I'm sorry, like a football, so that their head can get out a little easier. And that means when they come out, they kind of look like they're wearing a British constable's hat. And while that may be a little upsetting for you, it's totally normal and it'll go away really probably in the first 2 days. It goes away really quickly. So let's not worry about that. That's going to be fine. The third thing is all babies are going to be a little bit jaundiced. Where they lived inside you, there wasn't as much air, and so they had a lot more red blood cells. So they come out with an excess of red blood cells. And over the first few days, they breaking down a bunch of those, and then they recycle those in their liver. And one of the pieces they break down into is called bilirubin. It looks a little bit yellow. And as your liver is trying to get caught up, or their liver is trying to get caught up with the extra bilirubin load, their skin may look a little bit yellow, and that's totally normal. So this is very rarely a significant problem. It peaks around the 3rd or 4th day. I don't want you to worry about it. If you still have concerns, you may want to see I've made a video on jaundice and bilirubin that discusses it in a little bit more detail. The other thing that sometimes is upsetting for moms is the baby's stools. Keep in mind, those babies have not, in general, been pooping for the last 9 months while they're inside you, and they've accumulated a lot of a substance that's kind of dark black and tarry that's called meconium. It's actually sterile, but when they're passing it, it's a pretty dark, sticky material for the first couple of days, and that's totally normal. After that, their stools will kind of turn to a more mixture of maybe mustard and water with a little bit of cottage cheese thrown in, and that will be perfectly normal also. The number of stools is variable. A lot of babies will poop every time you feed them, and others may poop less than once a day. But as long as they're eating okay, either of those situations can be totally normal. The other thing that most moms are worried about at this point is whether or not the breastfeeding is going to work for you. Let me assure you that it's going to be fine. 95% of my moms breastfeed without any significant problem. And I have a simple test to help you know if you're going to be able to breastfeed. If you look at your new baby, and if you count their fingernails and toenails, and if they have 20 fingernails and toenails, then that means you have the genetic material necessary to make fingernails and toenails, and you didn't read any books or watch any videos on how to grow fingernails and toenails. And so the same thing is going to be true for your breastfeeding. 200 years ago, if I'd ask a mom, are you going to breastfeed? She'd say, Well, of course, what else is there? But now there's so many books and videos that it kind of steals our confidence. It makes us think it must be tough if we need all these books and videos. You didn't read any books on how to grow fingernails. You don't need to read any to how to produce breast milk. It's going to be fine. If you're in the small percentage, the 5% maybe where breastfeeding doesn't work out for you, just keep in mind there's not a doctor alive who can tell whether your baby was breast or bottle fed without asking. So it's going to work out. Don't worry about the breastfeeding at all. So those are the 5 things that most moms are worried about. What do you need to get home? You just need a few things. You need a car seat. You'll need a few diapers. You'll need a few blankets. And unless you've been convinced that they're evil, a pacifier or two would be nice. And even if you have been convinced that that bottles and things are evil, I probably would get a bottle or two with a nipple or two, just in case we need to give the baby a little water or something like that along the way. So when you get home, when I first got in this business, I shared a call with an older pediatrician, Dr. Joe, and he just had 3 simple rules. He said, feed them, change them, and don't drop them. And while that covers most things, I'm going to give you 3 more rules that maybe are a little more all-inclusive in my opinion. The first, we've alluded to, don't let them get too dry. If it turns out the breastfeeding is not going like it should and their mouth starts feeling, dry and pasty like a cat's mouth, it's okay to put a ½ ounce to an ounce of water in a little bottle and to give it to them. The internet's against water now. I'm not sure why. We've been using it for hundreds of thousands of years, and it's one of the primary things we like to use on a lifeboat. A little water never hurt anyone, and it's not going to compete with your breastfeeding. It's not going to cause nipple confusion, and letting your child get too dry is one of the few things you can do to really potentially harm them the first couple of weeks of life. The second, even though we talked that jaundice is not usually a big deal, if your baby gets so yellow that they're looking a little basketball colored, then we probably need to let your pediatrician's office know so that they can check that out. The third issue is a little bit more difficult, and it is that I want you to make sure that your child doesn't get ill and that they look okay. The problem is it takes you 2 months to get to know your child. And in 2 months, you can look at them and say, she just doesn't look right today. But the first few days, they never look right. So fortunately, you've been living with your husband, and he can help us with this because we can treat the baby pretty much like him. If dad is eating like a horse, he's usually okay. And that goes for your baby too. If they're eating like a horse, usually things can't be too bad. Likewise, dad sometimes will skip 1 meal because he has something important going on. And if he skips 1 meal, that may be okay too. If dad skips 2 meals in a row, that means that something is definitely going on. So if your baby skips 2 meals in a row, that's something that I think you might want to touch base with your pediatrician about. So those are the 3 things. And then everything else, we can take care of them along later in life. And even though I'm kind of a laid back pediatrician who feels like most everything is going to be okay, the first 2 weeks is really not the right time to be cavalier. So if you're worried that something is not right the first couple of weeks, maybe this is a pretty good time to call your doctor. So congratulations again, and good luck to you. And we'll talk about more in the future.